Hello, my name is Celine. I'm a clinical nutritionist, a social clinical nutritionist in the UK, and an eating disorder practitioner, and also a researcher and co-director of the WHO Collaborating Center for Public Health Education and Training. And today I'm going to be reacting to a roundtable from Dr. Ishani Sharma and Dr. Abdullah AlHalafi on vegan diets in pregnancy and early life. I'll be adding some commentary throughout. So let's get it started.
Rapid roundtable on the plant-based diets. My name is Ishani. I am a resident doctor in the NHS, but probably more relevant to this is I've been vegan for near on 10 years now.
Hi, my name is Abdullah AlHalafi. I'm clinical fellow at Imperial College and a preventive medicine doctor.
Our first kind of question that's come in is, iodine is crucial for the brain and nervous system development of a fetus, requiring an increased intake during pregnancy. In Europe, dairy is fortified with iodine, but plant milks are not. With so many people switching to plant milks, what is the best advice we can give to people trying to conceive? Should they take a supplement like kelp, or can they get enough iodine from modifying their diet? What do you think?
Iodine is essential for development of the neurological system for fetus. And taking iodine supplement is highly recommended for pregnant women, especially on vegan or vegetarian diet. Taking iodine from other sources like kelp have some limitation because this type or this source of iodine is very dependent on the brand or the source of iodine itself. So my recommendation to take the iodine supplement under supervision of GB.
I think the key thing with iodine is that, as you said, it's a really key supplement, is to make sure that whatever supplementation is done under medical supervision and is done safely, because you don't want it to go either way. You don't want to have too little and you don't want to have too much, because that can also cause complication.
This is such an important question, and it's usually a source of a lot of confusion. Kelp and seaweed, usually, they're not reliable sources of iodine because the levels vary hugely and can exceed those safe limits. So safe guidance usually during pregnancy is around 150 to 100 micrograms of iodine. And it's worth highlighting that dairy is the only iodine source because it's fortified through cow feed and sanitation processes. So we're talking about it not being naturally rich, hence why plant milks, mostly unfortified in Europe, this is where supplementation is the safest route. And this relates to a bigger issue where people often think that plant-based diets are expensive and nutritionally complicated, but iodine is a great example of how heavily animal foods rely on supplementation behind the scenes, but that's not mentioned. Cows get iodine supplements, chickens get iodine supplemented feed, and we're just cutting that middle step out and taking the supplementation directly instead of through the animals. And as Dr. Ishani did mention, and Dr. Abdullah, that taking too much can be a problem as well. So it's both too low and too high intake that can be harmful. So even pregnancy multivitamin doses don't require that medical supervision because it's routine public health guidance. So the key is consistency rather than adding kelp or seaweed consumption to the supplementation of iodine.
Exactly. And by talking about the supplementation, there is also a recommendation to take very important supplementation like folic acid, especially for vegan and vegetarian, during the planning period before pregnancy. And women can take folic acid supplementation before pregnancy and during the first trimester, which equal 12 weeks. This is very highly recommended. And also we can recommend also the vitamin D, especially in winter. It's very important.
Yeah, just another thing that I want to just highlight here is that Yes, their folic acid recommendations are the same for vegans and non-vegans, where it's 400 micrograms per day. And with what Abdullah mentioned about vitamin D, it isn't veganism that's not the problem. Most foods contain almost zero or none vitamin D, regardless of the diet that you're on. UK guidance actually suggests that everyone needs that 10 microgram daily in winter, and some groups all year round they do need that supplementation as well. And it's also worth noting that sometimes when it appears in animals, those are supplemented animals. Just like B12 and iodine, plant-based diets don't remove nutrients. They just remove the middleman of animal supplementation, hence why we should take them ourselves. To the next question.
So we've been asked, is a vegan diet safe for infants and toddlers, and what does the evidence say?
General talking, the vegan and vegetarian are safe diets if we plan the diets carefully and taking the macro and micronutrients sufficiently. So by taking the macronutrients that fulfill the requirement for children development, like protein, carbohydrate, and fat, take it in a good amount that ensure their development, and focusing on macronutrients that are specifically need more concern in vegetarian and vegan diet, like vitamin B12, sometimes iron, by taking supplement or the fortified food, like the cereals, breakfast cereals, or plant-based milks.
It goes back to making sure that things are well planned and done in a way where you have a good variety in your diet. And there's been multiple studies, and this is a growing field of research as vegan diets become more and more kind of commonplace. These need to be done with careful planning in mind.
Yes.
So it's a really good overview, and there's strong evidence that vegan diets can actually support normal growth when appropriately supplemented. So the biggest risks are, as mentioned, was B12, iodine, DHA, vitamin D, and sometimes iron. But this isn't something that's just unique to vegan diets. Iron deficiency is one of the most common deficiencies worldwide, regardless of your dietary pattern. And this is where I think another issue comes in about affordability, because the highly processed vegan foods are expensive. The ones that are trying to mimic the taste of other diets are usually quite expensive, especially when they're processed, and they're still quite unique and available to a set class of people. However, if we're talking about infants and toddlers and other adults that want appropriate plant foods, when we're saying lentils, beans, oats, potatoes, peanut butter, tofu, they're often some of the cheapest foods in the supermarket. So whole plant foods are incredibly cost effective when, as mentioned by Dr. Ishani, it is planned simply.
The next question is, does a vegan diet affect pregnancy?
General talking, vegan and vegetarian diets are safe for pregnant women. And vegetarian and vegan diet shows very helpful outcome for general and healthy population. So by planned diet before pregnancy, we don't have any restriction to recommend vegan or vegetarian diet for pregnant women. Talking about the folic acid, the recommended dose for folic acid is 400 micromilligram per day before getting pregnancy and until 12 weeks of getting pregnancy. And this is for general population, regardless of the type of diet that are doing. But there is some population at risk. They can increase this amount of folic acid, like women with diabetes, women with a specific type of disease like HIV, or infant with father has a history of neural tube defect. So general talk, vegan and vegetarian women, they are the same with general population.
I think that's a great point, because evidence from systematic reviews did show that similar pregnancy outcomes across all dietary patterns when nutritional needs are actually met. Again, Dr. Abdullah did mention those specific groups of people with other types of diseases that might be the problem. The difference then here isn't about who's vegan and who's non-vegan. It's whether the nutrients like B12, DHA, iodine, and iron are actually covered. And on B12 specifically, even all kinds of people that eat all kinds of food or diets often depend on fortified foods because farm animals now get B12 supplements themselves. And modern sanitation practices actually means that neither the animal nor the humans get B12 from the soil or water anymore, due to other public health practices. So the most reliable evidence-based option is that B12 supplementation, and of course, you need to get your healthcare professionals to actually tell you exactly how much you need.
Our next question is, what are the best iron-rich food combinations? In an age where there's lots of information circling around about superfoods and things, there are some really essential kind of foods that will kind of have stood the test of time. So that's your kind of lentils, your beans, your kind of dried nuts and fruits. You've got, the classic spinach, broccoli, green leafy vegetables. But I think there's probably more to this about iron-rich food combinations, which I will pass to you.
Yeah, I think that's such a good list of iron-rich plant foods, and vegans actually have more control over iron absorption because of the non-heme iron that adjusts based on the body needs and doesn't drive oxidative stress the way heme iron actually can.
Yeah, actually, it's an excellent answer. The taking whole grain and plant-based food diet, which is can be applied in vegan and vegetarian diet, ensure that you get the iron source of food from legumes like lentil, leafy greens like kale, spinach, broccoli, and nuts, seeds, and also the fortified milk. All of these guarantee you get the enough amount of iron. And here I want to highlight the importance of eating rainbow.
Yeah, before we get into that, I just want to add that iron absorption, back to the question about the evidence on iron absorption, is quite powerful because pairing iron rich foods that was listed beautifully by Ishani and Abdullah was pairing these kinds of foods with vitamin C usually, so anything citrusy, peppers and berries and leafy greens actually can increase absorption of iron by up to 3 to 4 times. So like simple additions to any kind of meal like lemon juice, vinegar, or just simply avoiding tea and coffee around meals can actually make a huge difference to iron absorption.
Can eat more than type of one specific type of food, like eating vegetables and fruits with multiple different groups. That ensure we got more than our need from specific vitamin and enhancing our absorption. Like if we take iron supplement or food with vitamin C food, that enhance the absorption of our iron food.
I spoke too soon. He did cover it.
And this idea of eating a rainbow, it's not something it's something that's been kind of widely I say advertised, but actually just we're building awareness around it because having lots of colors on your plate and lots of different types of foods and fruits and vegetables is probably the easiest way that you manage to keep all of these nutrients in your diet on a regular basis.
Yeah, absolutely. And that eating the rainbow is actually backed by so much evidence because the diversity of plant foods, it improves fiber intake, your gut health, micronutrient coverage, and this ties to an important issue of cost and accessibility. And many colorful whole foods, carrots, cabbage, frozen berries, tinned tomatoes are among the most affordable foods available for us. Oh, and also like the belief that plant-based diets are expensive often comes from looking at vegan substitutes and not the actual whole foods. So beans, grains, and seasonal vegetables, everything that I've listed and Ishani and Abdullah listed in this video are some of the cheapest calorie for calorie nutrient resources. And it's just the media and who covers the media and what you hear about vegan substitutes and who could contribute to that discussion and what voices are actually not heard enough from that plant-based nutrition world. That is around for another day, but that is something to keep in our minds that those plant-based diets or plant-based foods or nutrients can be done in a cheap way.
Whilst well-planned vegan diets can meet nutritional needs in pregnancy and early life, how should public health guidance balance individual autonomy and cultural food choices with the population level risk of micronutrient deficiencies, so for example, B12, iodine, iron, especially in socially disadvantaged groups with limited access to fortified foods or supplements?
This is a very important question. Increasing the health literacy among general population and the importance of it, which is including the vegan and the vegetarian, very important to enable our patient to take their healthy choices by their own. Of course, vegan and vegetarian diet have advantage, and by increasing this health literacy among population, we enable them to increase the demand on the healthy choices, and that will increase the healthy choices on the food store.
Agreed, and I think there's lots of different factors that go into this. It's quite a kind of loaded question, I suppose. There's lots of different angles that you can take, and I think you make a very good point there. That I think autonomy and being able to empower patients and empower just people to make choices about their health. It comes from kind of having that access to healthy foods, having access to support and healthcare throughout their kind of pregnancy, and I think that's something that, from a public health level and from just a policy level, that is something that we continue to strive and work towards, because I think that is still sadly a disparity that we face, and yeah, I think that meeting that guidance needs to make sure that whatever we do and whatever people pick up, it's sustainable. It's something that they can stick to. It's something that works for their own needs. Everybody is different, but they still have access to the support and kind of healthcare guidance that they need.
That is so important. This is why budget-focused facilitation is crucial. So helping people understand how to build the meals from affordable staples like oats, rice, beans, lentils, frozen vegetable, everything that we've mentioned so far. It's far more impactful than promoting expensive meat alternatives, because as mentioned, many groups do lack access to affordable fortified foods, supplementations, and culturally relevant nutritional advice, sadly.
Our final question is, should vegan pregnancy guidance be universal and permissive, or more targeted and conditional based on health literacy, food security, and access to dietetic support?
Actually, this sort of question bring the idea of health promotion among general population. So we should promote the healthy diet, which include the vegetarian and vegan, to general population. The advantage of vegan and vegetarian upon other type of diet make it highly recommended among general population. So the public health authority should promote this sort of health literacy among the general population and also the new generation at the school.
I think emphasizing that part of having that health and part of having a general population health, vegan pregnancy guidance is not separate. It's part of that. We're kind of looking out for the health and supporting health for that whole group as one. And I think it's hopefully, as research continues and as we have a better understanding of, of health and how to improve general population health, I think this is going to be an exciting area that continues to expand.
Absolutely, and I agree. Like, vegan diets are and can be healthy for everyone, but public health messaging must be both universal and targeted. So we've tackled a lot of things. Universally speaking, vegan diets are safe with appropriate supplements. However, we cannot forget the targeted advice where extra support is needed for those with low income, low health literacy, limited access to fortified foods, or from culturally diverse food environments. And we shouldn't forget that some key nutrients have variability even within plant based foods. So, when I say selenium, for example, it depends on soil. That means two Brazil nuts usually often meet the requirement needed, but their selenium levels actually vary sometimes. So, guidance again must be precise and realistic, and needs that multidisciplinary team that can have a lot of different perspectives from different backgrounds so we can make those advices or guidances to the population evidence-based.
All this to say, the main things, I suppose, are, if you are vegan and planning on becoming pregnant, it's definitely worth consulting your medical professional. This is not medical advice, but consult your medical professional. And there's a lot of guidance and a lot of support out there for people who are vegan and planning on getting pregnant.
This is a good advice.
But it's been a pleasure.
Thank you. I'm glad. Thank you so much.
Perfect. I think to wrap up the roundtable, really, it highlighted some core points. We have vegan and plant diets can fully support healthy pregnancy and early life when they're well planned, supported with right supplements like B12, iodine, vitamin D was mentioned, when people have access to affordable fortified foods and good nutritional advice. And that's why public health guidance needs to be both universal, that recognizes plant-based diets as safe and targeted so groups with lower food security or health literacy can get the support they need. But it also is important to step back and recognize why increasing plant-based eating matters for all of us. There's large cohort studies that show healthier plant-rich diets are linked to lower cardiovascular disease and around 30% lower greenhouse gas emissions compared with more animal-heavy diets. There's other modeling studies that show even modest shifts, like adding more legumes and reducing red and processed meat, can cut warming impacts by over 50% while keeping diet quality high. And broader reviews actually consistently confirm that plant-based diets patterns have lower environmental footprints and support both human and planetary health when nutrients are met. So the conclusion is simple. Supporting people to adopt more plant-based diets isn't just about personal nutrition, which is very important. However, it is one of the most impactful steps we can take for health equity, climate stability, and a sustainable food future. Thank you so much. And I hope this was fruitful and educational. And do share with us any topics or anything that you'd like us to react to in the future.